We will be starting momentarily.
A beautiful good morning, everybody. Thank you so much for being here this morning outside of the BC Women's Hospital for a beautiful day and what I think is a beautiful policy announcement. I'm very, very proud of what John is about to announce. I think that this is a tremendous thing for British Columbia, and I don't want to hold you up, so without further ado, please welcome our leader and the next Premier of British Columbia, John Rustad.
Thanks very much, and thanks everybody for coming out today. It is a pleasure to be able to be here today, and it's a pleasure to be joined by a number of our candidates that are here to support the efforts that we're going to make in this announcement. And the key in my mind for people across this province is many, many women and many, many families want to be able to have children. They want to make sure that they have that opportunity, and as a Conservatives, we want to be able to support that as well. Unfortunately for my wife and I, we were unable to have a child, but I know what it means for many, many people. I have 6 nieces and nephews. I've now got 1 grandniece and 1 grandnephew, and it's wonderful to see them, wonderful to see their lives and in terms of what's happening. And I know that many people around this province want to be able to experience the same thing. So we are going to make some significant improvements for women's health, particularly in terms of helping for families, helping to make sure that families can be able to achieve being able to have children. So in British Columbia currently, there's been a commitment to fund a first round of IVF. And many times what I'm hearing from families, what I'm hearing from health experts is many times 1 round is not enough. That sometimes it takes a second round for that to be able to be successful. So what we are planning to do is we will fund both the first and a second round of in vitro fertilization treatment so that couples can have the best opportunity possible to be able to have a child here in British Columbia. But it's more than that. For a woman who has the tragedy of having a miscarriage, it can be very emotional and very difficult for a woman. And so we want to be able to recognize that and support that. And so what we will do is we are going to make sure that there can be 1 month of grievance of leave that's available for a mother who has in that unfortunate situation to be able to help her, to be able to help get through so that she doesn't feel that she needs to be rushed immediately to go back into the workforce and to go back to her job. Part of also of having children is many people would like to be able to have midwives to be able to help them through that process, and that's something that we do not have a lot of here in British Columbia. So we are going to be supporting families by expanding training for midwives and have a dedicated program and facility within Surrey to be able to help with this. Surrey is a community that is having the largest number of children in the province, and it makes sense to be able to put in place the opportunity for that training to be able to be there for people. It also means having the opportunity for a conversion program for nurses that would like to be able to take that on and be able to make sure that they can provide those services for people. For many families as well, having a child may not be an option, and however, they may want to adopt. And so we have programs in place that support help families to be able to adopt. But for some families, that can be very expensive, and that could be out of reach. And so we're going to be able to provide financial support to families that would like to be able to adopt a child. And I think it's just important when you think about a child, it's important that we think about how to make sure that child can have a forever family, how to make sure that child has that opportunity to be able to grow up in a loving and caring family. And there are many families, I think, that would like to be able to do that, but like I say, financially it could be a barrier, so we want to be able to provide support for those families to be able to achieve that. And the last piece, which is also near and dear to my heart, because my wife did have cervical cancer, and fortunately, she was caught early and she was treated. But when I hear from doctors, particularly doctors in Surrey, that say that outcome may not have been the same today, because of how difficult it is to be able to get through the health system. We want to make sure that we do everything we can to expand the opportunity for research and treatment for people, for women with cervical and ovarian cancers. And so it's a commitment from our government to put additional funding towards that research, the work that needs to be done to make sure that we can provide the best options possible for women and for women's care. All of this combined will make a huge difference for families right across this province to make sure that families can be able to achieve what they would like to achieve, whether they want to be able to have children, whether they want to be able to adopt children, and also in terms of the care and compassion that should be there and needs to be there by government for those families. So with that, I'm going to turn it back over to Eleanor to share a few more words.
All right, thanks. I'm grateful to John. I wanted to be able to share a little bit of mine and my spouse Melissa's own journey. We became parents the first time in 2011, and then we had twins in 2013. And both of our pregnancies were only possible as a result of in vitro, pardon me. I went through several rounds of artificial insemination and I was unsuccessful. And then I was diagnosed with a fertility issue. And so for us, having that ability to have in vitro really was the difference between being able to fulfill our dream of parenthood and not. And, we also were a couple that had experienced pregnancy loss. And it's, many couples have gone through this. It's tremendously difficult. So much anticipation that goes into trying to conceive and all the hopes that couples have. And when you experience pregnancy loss, it's devastating. And so I'm grateful to John for his leadership in this issue, being able to provide not one, but 2 rounds of in vitro fertilization for couples who want to conceive here in BC, I think is wonderful. And also, having experienced firsthand, what pregnancy loss is like, I think this move towards supporting couples, supporting people who've experienced pregnancy loss with leave so that they have the space that they need to recover from what that's like, I think is tremendous leadership by the Conservative Party of BC. And so I'm grateful to you, John, for doing this. My kids are now 10 and 13, so it's been quite a while since I was actually at the BC Centre for Reproductive Medicine in Burnaby. Tremendous experience, costly experience, but I would not want to skip that opportunity for anything. So, I look forward to being able to implement this policy if we have the honor of forming the next government. And with that, I'll turn it back over to John. Thank you.
Thanks very much, Eleanor, for sharing that story. And it is such an important issue for so many families in British Columbia. And so with that, I open it up to take any questions.
Thank you, John. Thank you, Eleanor. We're going to start